From the Toronto Star, I'm Sabah Itazaz, and this matters. Have you asked yourself yet, will we ever be able to measure the weight of what we lost and what we learned during this pandemic? At first, we called COVID-19 the great equalizer. Then we did not. The virus did not discriminate, but inevitably people and the structures they constructed did. The pandemic exposed the inequities of the world and amplified many others as the most vulnerable of our societies started falling through the cracks. Some we saw coming, some we didn't. It's been a time of reckonings and realizations. Does that mean people and policies might change for the better? That's what award-winning journalist Stephanie Nolen set out to investigate as the 2020-21 Atkinson Fellow in Public Policy. She's done a deep dive on the impact of COVID-19 in Canada, where it hit hardest, who was most affected, what institutions created those vulnerabilities, and most importantly, she asks the question we're all asking: what will we choose to do with this moment in time? You will get to read that and more in the Toronto Star as her Atkinson series, What COVID Reveals, launches on Tuesday. But you get a sneak peek of what's coming as she joins me on This Matters today to talk about her extensive reporting project. Hi, Stephanie. Thanks for joining me on the podcast today.
Thank you for having me.
Let's start off with a little bit of background. How did you end up with an Atkinson Fellowship? This was a few months into the pandemic and we were still kind of trying to understand the actual impacts. Tell me more about what you chose to cover then and why.
I had been talking to the Atkinson Foundation about doing a fellowship on a project in Canada. And I also had a lot of plans for 2020 for big international reporting projects, which, needless to say, in the first weeks of March, suddenly became impossible. And I think that the foundation, a lot of what they had envisioned for the year also became impossible. And I said to them, look, my original project pitch, which would have involved a lot of time in hospitals, is clearly not viable. But I've spent a lot of my career looking at, as it happens, pandemics and their impact on societies. And can I write you a new proposal that looks at the pandemic through this lens of social inclusion and inequality that I've looked at a lot of other places, which was novel for me. I've spent most of my journalistic career outside of Canada. And so it was this is the first time in 25 years, really, that I've done a lot of reporting within Canada. So that was a bit of a learning curve. But I think the foundation, like everybody else, was also trying to say, okay, whole new scenario, what's the most effective thing that we can do? And so I said, look, why don't I use this fellowship year to look at the pandemic and inequality and what we learn about Canada as the year goes on? And, and I can't tell you exactly what I'll do because we don't know what'll happen, but clearly this is going to be momentous. And so why don't I take this year to track what happens?
And as we've seen around the world and here as well, a pandemic like this kind of just feeds on social inequities and health system disparities. What did you expect going into this and choosing to explore the impacts of the pandemic, especially on vulnerable groups in Canada? Did something surprise you?
So, I did, for example, years and years of work on the HIV pandemic in sub-Saharan Africa. And I knew that health crises are really useful for illuminating a lot of things about a society. HIV preys on stigma and the shame and things that we don't like to talk about, right? And so there was every reason to think that this virus also was going to thrive in the kind of dark crevices of our society, right? In the inequalities, in the things that we all say are unfortunate and problematic and that we really haven't done anything about, right? Or haven't done enough about. And, there was immediately clear. If you think about it, I know March 2020 is like 1,000 years ago, right? But if you think about the early winter of 2020, the first public health order was stay home, right? So obviously, vis-a-vis homeless people experiencing homelessness, that was an irrelevant, right away, the crisis that was going to create was apparent. And when I've spoken to people who work with the homeless, they've said in January, February, we knew that this was a group that was going to be in the crosshairs, right? So some of those things were very obvious. When I look back at my notes of what I mapped out in March and April of 2020 of who I would look at, some of those things were very clear. And then others emerged along the way, and I didn't see those coming.
Like which ones?
So I think that the big one is what happened to working women, right? So all previous recessions have had a much greater impact on men and men's employment and men's income than they do on women. And that reflects usually what industries shut down or experience a big recession. So manufacturing, construction, industry, those are areas where disproportionately employ men. And those are usually the ones that see the big cutbacks. And of course, this time, totally different from all of our previous experience of recessions. It was people-facing industries. It was retail and hospitality and tourism where the huge layoffs, the overnight mass layoffs happened, right? And so all of a sudden, by late April of 2020, women have gone back decades in terms of their employment and their workforce participation. It's all of a sudden, it's like the early 1980s, right? And it happens first because of the layoffs. And then as schools and daycares stay closed, somebody has to take care of children, and overwhelmingly, disproportionately, that becomes women. So that was also, I think, like a moment of revelation where it was like, oh, we think there's been all this progress in terms of the gender division of labor. We knew that women still did more childcare. We knew women did more domestic labor. We knew women did more caregiving. I think a lot of people who work in this field that I've spoken to have been taken aback by just how big the shift was, right? 12 times more women than men left work to take on a caregiving responsibility, whether, mostly children, also some older people. So the fact that women's work was set back so far, so quickly, so dramatically, and hasn't recovered in the same way that men's has, right? Like far more men are now employed, far more of the gap in men who lost jobs has been made up than the number of women. And then the fact that we would suddenly get such a stark demonstration of who is still considered responsible for caregiving. That was also a bit of a surprise. So that, in my early days of mapping out the project, I wasn't planning to look at what happened to working women, but pretty quickly it became clear that this was going to be really important.
Right. This pandemic has certainly had a lot of revelations around that. Before I get into the details, I do want to talk to you about the scope of this project, especially in pandemic times. How does a journalist do the kind of extensive reporting that's needed as a part of this while navigating a pandemic and numerous lockdowns? Did you have challenges doing this?
Yeah. There were some challenges. It's funny. So I've worked in a lot of war zones, a lot of big humanitarian crises. Did a lot of reporting in the Brazilian Amazon that involved like days of travel on rivers and canoes. This was maybe a bigger reporting challenge than, I won't say all of those, but than most of those, because I couldn't go anywhere, right? My whole MO as a reporter is go somewhere, go where the story is, sit down, spend time there, spend a lot of time with people, build relationships. I've had the luxury in years as a foreign correspondent of really being able to go and sit with a story, right? And I'm in Nova Scotia. I'm in Northern Cape Breton Island on my in-laws' farm, which is where we spent the first 7 months of the pandemic. And it's beautiful. And it was very safe here, right? We're 1,000 miles from the nearest COVID case, but I'm not going anywhere, right? I couldn't go anywhere and find these people. So the great luxury of a year-long fellowship is it gives you a year to get to know people and follow what happens to them. And that's what I wanted to do in terms of tracing the impact of the pandemic on people and also the impact of public policy, right? Ultimately, that's the point of the fellowship, is to assess public policy. So following vulnerable people over the year and seeing what happened to them was a great way to do that. But I needed to find those people. And I couldn't do that in any of the ways that I normally would, right? So I couldn't, for example, to write about the impact on migrant workers, temporary foreign workers, refugees who were, for example, working in a meat processing plant that had a raging COVID outbreak. Normally, I would figure out where people go when they get off shift, right? Do they go to a bar? Do they go to the local Tim's? And I would go and I would sit there and I would start chatting to people. And maybe the first 10 people wouldn't be super interested in talking to me, but somebody eventually would, right? And they'd introduce me to some more people. Well, clearly I'm not doing that, right? So the first thing was that I was reliant on kind of intermediaries. So the people who do, people working in homeless shelters, people who were delivering support to First Nations, union organizers, advocacy organizations, to say, can you introduce me to some people? And so I'm asking people who are already massively overworked, under-resourced, overwhelmed, facing a situation they've never faced. And I'm like, hey, could you also just help out this reporter? Right? Like it was, so making those connections was really hard. And then building a trusting relationship with people over the phone was really hard. And then, it just involved learning a lot of new reporting strategies. I would say to people like, let's use FaceTime and can you show me around where you are? Take a picture of the room. If something extraordinary happens, like, you find out you might get housed, you get taken to see an apartment, you have to go to the ER, your business gets shut down, it gets a shutdown order. Can you record me a voice memo in those, right at that moment? Will you just send me like 25 seconds of how you're feeling? So trying to kind of find ways to work around the kind of reporting that I would normally do. It was not ideal.
I can imagine.
I will just say it was not ideal and it's been challenging. But, whose work life hasn't been challenging in the past year, right? Like at least I had the enormous privilege of being somewhere safe. Oh, and then I should just say, I was kind of living one of these stories, right? Because I have 2 kids. And so they were not at school. And so I was trying to map out the pandemic and do the fellowship and also like help with the grade 4 long division programming. It was like, I'll write this thoughtful thing this afternoon while also building the solar system out of macaroni, right? Like it was hard.
We'll be right back. You talk about this in your reporting as well, how a lot of experts are calling this a she session and how the pandemic has set back the clock on progress made. Now that so many people are getting vaccinated and we're on a fast track to reopening, is it possible to just plunge back into post-pandemic life for so many of these women whose lives and careers might have changed irreversibly? How can we go back to business as usual?
So I think I can, probably how about you can, right? Like our lives may in 3 or 4 months look a lot like a lot of other people's. The people in my project, their lives are never going to look the same as they did before. And for a few people, that's a positive. And for others, it's really not. And I think it's one of the big challenges of this moment is there is an understandable desire to go back to normal, right? To make life look as much like it used to as quickly as we can. And there is an opportunity here. There's a moment, there's a window, there's a chance to make things different, right? Like, so just to give you an example, in terms of people experiencing homelessness, in the first weeks of the pandemic, we did a thing that we've been saying for decades we couldn't do, right? We housed a whole lot of people. There was a real acceleration in getting people out of shelters, off the streets, into hotels, into temporary housing. And a lot of that momentum has continued through the year and a half of people getting into housing much more quickly than they used to. Well, what happens now? What happens with that lesson that we learned about how you could do it and what an incredible positive impact it had for most people? Do we go back to the way that we used to do things? And it will be interesting, I think, to see how many of the lessons and how many of the changes endure. I'm also conscious from the people that I'm talking about that a lot of the, for lack of a better word, the scars are not super visible, right? Like, so the working women who in the past couple of weeks have gone back to jobs, like I think especially racialized low wage women who have been out of work for the last 16, 17 months, who now have jobs to go back to, they're down $30,000, $40,000, $50,000, right? And if you make 50 grand a year or 40 grand a year, that's a massive, massive financial hit. And you have debt now that you can't manage. Maybe you or someone in your family has really struggled with mental health and there's like a new layer of costs that you weren't anticipating. Even I think a lot of the middle class women that I interviewed for the project, there's a woman in this story whose job disappeared early in the pandemic. And she will be the first person to say that she was quite fortunate, first world problems, right? Her spouse kept his job. They still had his medical benefits. They were still housed, but she lost her paid mat leave. She lost her daycare subsidy, disappeared over the course of the year. She had twins. Now she's looking at the fact that if she goes back to work, she's down, tens of thousands of dollars in terms of the income she lost this year. And she's facing the prospect that she's paying for childcare for 3 kids. And so suddenly the idea of going back to work is maybe not fiscally viable. And this is a whole interruption in her career trajectory. And then, of course, like also in her sense of herself and her identity that she never anticipated. You know, if you'd asked her in the first week of March 2020, are you going to be a stay-at-home mom and out of the workforce for 5 years and give up your whole professional life? She would have said, no, never, right? So even if she eventually ends up back at work, there's this economic scar and also like a real change in her sense of herself and her relationship with her partner and her community that's permanent, right? Like that doesn't go away, even if we don't see it when we look at her.
Absolutely. And I don't have the exact data on this, but I was talking to another expert in a think tank, and they said that a lot of mid to senior level career women are actually dropping out of the workforce, a lot of them racialized women as well. So this is sort of like a top to bottom kind of a problem.
Yeah. And, you know, you just reminded me of that, like one of the upsides coming out of this is that finally a lot of data collection is getting disaggregated by race, which is a thing that should have happened, obviously, a really long time ago, but by gender. And gender had already, in most cases, not totally, but, we were doing better sort of differentiating data collection by gender, but we weren't doing it by race. And so you were reliant on kind of anecdotal reporting early in the pandemic that it was having an outsized impact on racialized people. So especially, infection rates and illness rates and the actual health impact, but also the economic impact has been, for example, it has been much, much harder on recent immigrant women and on racialized women generally. And that was not data that Statistics Canada used to collect, right? Starting in July of 2021. So that I think that will be a positive going forward.
Right. The coming of race-based data is absolutely important. Let's talk about some of the other groups you reported on. Why did you choose to study the pandemic's impact on migrants? And do you feel that COVID-19 exposed what a lot of Canadians might not know about how vulnerable and precariously positioned migrant workers are here?
Yeah, so that's another great one where I feel like a lot of people learned something about the country and the way things work here that I hope is information we hold on to going forward, right? Like I hope that we just don't abandon that conversation in the months to come. I wanted to look at migrants and I use that kind of title broadly for refugee claimants and asylum seekers, for undocumented workers, for temporary foreign workers, for international students, a huge number of who come here, at least partly because it gives them access to working in Canada. I wanted to look at them because I've written about Canada's immigration system from the other side for kind of 25 years. I wrote about the places that send Canada refugees and people trying to come here to work as temporary foreign workers or as caregivers. For example, I wrote a lot about the migrant worker program when I was a correspondent in Mexico. So I had some sense of why people come and what that's like when they come and what that means for them and for their families and when they go home. And so I thought, okay, I know about the vulnerability of some of these people in a way that maybe Canadians have had the privilege of not really thinking about too much, like who is working the drive-through of your Tim Hortons, or who processed the chicken you had for dinner, or who picked your strawberries, or who is the caregiver for your grandma at the nursing home. And so all of a sudden, when there were these terrible COVID outbreaks in the overcrowded bunkhouses on farms for temporary farm workers, at the meat processing plants, when personal care workers, were getting infected and dying in nursing homes or long-term care homes, and we were realizing that a lot of those people didn't have permanent residence, their vulnerability was evident. And that to me, really was a moment to talk about our immigration system. So again, if I had $1 for every time I got in a taxi in Sao Paulo or Lagos or Dhaka or Karachi, and the cab driver was like, oh, you're Canadian. Let's talk about the express class entry system. I have 250 points and my wife has, people know their point value, right? For this points system that Canada uses to bring in what we call people with high social capital. So people with a lot of education or professional experience or a lot of money in the bank. Those people are prioritized by our immigration system. But we have all these jobs that we want people to do, people that we bring here to do those jobs, to work in the nursing homes, to process the meat, that are jobs that we bring people here to do with the express condition that they will leave again, right? They don't have access to permanent residency. They don't have access to citizenship. And that sets up this system where they don't have the same healthcare access, education access, labor rights that Canadians or permanent residents do. And all of a sudden we were talking about and aware of those people in a way we hadn't been before. And so what I wanted to watch through the year was, does this prompt a reckoning with how the immigration system works, with the terms on which we bring people here? And, there's been some of it. There hasn't been as much of a sort of shift as I think a lot of migrant rights advocates were hoping for early on in the year. But I think this is a really good example of a conversation that can continue in the months ahead. And that, maybe we've learned something that means there is still a radical overhaul. Probably there's not going to be anything radical. Maybe a significant overhaul in how we deal with this. And fundamentally a system that I think most people would agree now is quite unjust. So we've been confronted with that. What do we do with that knowledge?
Right. And like you said, so many of the especially temporary migrant workers had no COVID safety nets or health benefits, and they were particularly exposed to the perils of the virus as well. Is there any particular story or anything that kind of stands out to you during your reporting of this?
So I was talking to lots and lots of people every week, every 2 weeks, trying to track them through the year. And in the end, not everyone's story is in the project. And particularly in the case of migrants, that's partly because a lot of them just didn't feel safe, right? So the undocumented people, it is an open secret that the private long-term care industry and the construction industry, they only function because of the labor of undocumented people, right? 500,000 undocumented people here conservatively. So a lot of them didn't feel safe telling their stories. One person who did is a guy named Francis Dembe in Toronto, who's a personal support worker. And he works double shifts almost every day in a homeless shelter and a long-term care facility. And he's a refugee claimant, so from Uganda. And so he doesn't have access, he doesn't have a health card, right? Doesn't have OHIP. And he's going to work all day long in these shelters with raging COVID outbreaks, in nursing homes with raging COVID outbreaks. And he said to me at one point, I just feel like I'm being sacrificed. Like I'm being sent to my death. And meanwhile, Francis has been here for 3 years and he's sort of stuck in limbo. He doesn't have permanent residence. He has perpetually delayed refugee hearings. Refugee hearings have been just massively delayed by the pandemic, which, as Francis says, you would think at a moment that the system is essentially shut down because no one else can get here, you would think that would speed things up, not slow it down, but it really slowed things down. And so in addition to working in these profoundly stressful conditions every day, he's just in limbo. He has 3 little kids in Uganda. He doesn't know when he'll see them. He doesn't know when it'll be possible to bring them here. And he's just stuck. And it's just an enormous amount of stress for a person to be carrying on top of, a pandemic.
Over the past years, I've seen a lot of what you're talking about take place. And I've often thought to myself, were we always just one pandemic away from a lot of people falling through the cracks? What were your thoughts after your project and reporting? Is there anything we can take away from this? Or do we just conclude that this is how things are? Or are we looking at a different, better post-COVID era?
I mean, one would hope, right? I think it'll take time. And this is maybe a lesson that I learned from covering HIV in sub-Saharan Africa, which is obviously a pandemic that's still going on. But I lived there and covered that through the years of the highest levels of deaths and then the beginning of treatment. And when it moved into a new phase where, HIV is now a treatable illness, it took a long time to take stock of okay, we all just went through a terrible, traumatic, socially fracturing thing. Took a long time to really take stock of how has that changed us, right? So I was speaking with David Green, who's an economist at the University of British Columbia a couple of months ago, who's one of the many very smart people who's been very generous with their time talking to me over the course of this. And I was saying to him, I was expressing, I guess, alarm at the speed as vaccination started to speed up, the alarm at the rate with which people were really focused on the future and not so interested in introspection right now, right? And he said, if you think about the last time there was a big progressive shift in Canada, when we rolled out universal healthcare and when in lots of ways this just became a more equitable country, which was after the Second World War, he said, it didn't happen in 1946 or 1947. It took a number of years for the big shifts that were ignited by that very dramatic event to turn into lasting policy, right? So national childcare seems something, again, that we've talked about for 30 or 40 years, seems finally to be happening, right? Like that is a reality. $10 a day daycare, a thing that we have known for so long would make this a more equitable country, is finally happening. Most of the experts I've talked to have said that shove would not have come without the pandemic. There has been a massive increase in investment in affordable housing and in other steps that will reduce chronic homelessness. And there's a stated goal now to end chronic homelessness, which we never had. I don't think that would have happened without the pandemic. The other stuff, to go back to like kind of what you were saying earlier about, for example, the kind of inbuilt inequities that mean racialized people were more affected, that other stuff is going to require like a whole web of policy changes, right? And so I think it's too soon to say, will we use this opportunity? Will we squander it? But I took heart from David saying to me, it's not going to happen tomorrow. And you can't conclude by December of this year, this is all we did with this moment, right? Like we've been forced to confront things and we've learned things that over time may result in some really significant changes. And it will be a while both before we see what this has cost us, but also what we do with what we learned.
Stephanie, thank you so much for putting in so much insight in this very limited time we had. I wish we had many more conversations around this. So important. Thank you so much.
Thanks for having me.
I was talking to Stephanie Nolen. She's a 2020-21 Atkinson Fellow in Public Policy. She's also spent decades overseas as a foreign correspondent for the Globe and Mail and other publications. And in August, she will be taking up a new role as the global health reporter for the New York Times. That's it for today. Thanks so much for listening. This Matters is hosted and produced by me, Sabai Tizaz, Adrian Chung, and Raju Mudhir. Produced and mixed by Sean Pattenden, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.